Hello there. A very warm welcome to RN Instructor channel. Today we are going to look on blood products and blood transfusion, different types of blood products and what are the antibodies present in our body and reaction that is acute or the delayed reaction. So let's begin. The main objectives for today's presentation are to identify the blood and blood products used during the time of transfusion and understand the ABO and RH blood group. So, definition: blood transfusion is defined as administration of blood components via intravenous line, whereas the adverse reaction is defined as a reaction that is intended or desired and is definitely, probably, or possibly a response to administration of the blood products. Cross-matching: it is defined as to determine incompatibility between the donor and the recipient blood prior to transfusion. It's used to verify the ABO incompatibility and presence of antibodies in the recipient blood. Blood is a specialized organ that differs from other organs. It exists in a fluid state in the body, right? Blood is considered as a river of life, fluid of growth, fluid of health. Average human has 5 liters of blood in the body, that is 8% of the total body weight. It is a transporting fluid. It transports the fluid, okay? It carries the vital substances of all parts of your body. The color of the blood ranges. Like example, if oxygen-rich blood is there, then it is a scarlet red, bright crimson type of color. If the oxygen is poor in the blood, that also considered as hypoxia, then the skin or the blood turns to the purple red in color. The red color comes from the several million red cells present in it. The pH remains between 7.35 to 7.45. The temperature of the blood in the body maintains between 38 degrees Celsius or 100.4 degrees Celsius. The components of the blood consist of the red blood cells, white blood cells. Red blood cells, also known as erythrocytes, white blood cells, also known as leukocytes, plasma, serum, platelets, as well as the basophils, eosinophils, so many content of the components present in the blood. The summary of the composition can be described more detail as the plasma. 55 to 60% of plasma is present, which is a fluid portion of the blood, contains 91 to 92% of water. Albumin and globulin, which is crucial hormones and clotting factors. Whereas the red cells, it transport oxygen from one cell to the another cell, tissues of the body, and return carbon dioxide back to the lungs. Whereas the white cells, white blood cells or leukocytes, it protects against the infections. Whereas the platelets, small platelet-shaped cells, together it helps in clotting during the time of any injury. So as we have the different kind of the blood cells, it usually works in different ways in the body and all are essential. The lab values of the patient blood can be human blood, hemoglobin 13 to 18 grams in the men, 12 to 16 grams in the women. Hematocrit, that is the HCT, 48 to 52% in the men, whereas 38 to 48% in women. The purpose of the blood product administration are to increase the ability to carry oxygen, to restore blood volume when there has been a great loss due to RTA cases example, to improve the blood clotting ability and to improve a recipient's immunity. Coming to the different types of transfusion in the hospital settings, we can see the transfusion of the whole blood. It consists of all the components of the blood products, or else just PRBC in case of anemia example, plasma and cryoprecipitates in the case of the bleeding disorders, as well as granulocytes and fractionated plasma proteins and platelets. The whole blood. It consists of the RBC, WBC, platelet, electrolytes, and plasma. The most major indications are active massive blood loss and the trauma. RBC or PRBC or just red blood cells, it increases the patient's oxygen carrying capacity. 1 unit of the PRBC increases 3% of HCT or 1 gram per deciliter. Plasma or FFP, fresh frozen plasma, the treatment of the blood loss or during the time of blood clotting disorders. 1 ml increases 1% of the clotting factor. Platelets is usually given in case of thrombocytopenia, that is the decreased platelet count less than 50,000. Each unit increases the 5,000 platelet after 1 hour. Cryoprecipitate is the correction for deficiency of the factor 8. Granulocytes, it's given in case of profoundly granulocytopenia, that is less than 500 granulocytes in the body. The indications are serious infections which is not responsive to the antibiotic therapy, granulocytes are administered. Fractionated plasma products such as colloid solutions, albumin, plasma protein fraction, immune serum globulins, IV immunoglobulin, factor 8 concentrate, factor 9 concentrate are given to the patient in case of any of the fluid loss from the body or else deficiencies. The major thing we need to focus on during the time of blood transfusion is what type of blood grouping the donor and the recipient is having, compatibility of the donors and the recipient blood, as well as the cross matching. The antibody is a protein found in our body which is also known as immunoglobulin, Ig, whereas antigen is a substance produced by the foreign bodies that may be protein, carbohydrates, nucleic acid, or the lipids. They trigger the formation of antibodies. The different types of antibodies present in our body, there are 5 types. First is IgA. The immunoglobulin protects the body against gastrointestinal and the respiratory problems, whereas IgD is a part of B cell receptor, activates mast cell and the basophils. Whereas the IgE, this antibody controls the allergic reactions in the body. IgG, these are extremely important antibodies which stimulates phagocytes able to cross the placenta and into the fetus also. Whereas the IgM, this is the largest antibody responsible for early stages of immunity. As we are having different types of blood products, each individual vary with their blood components such as A positive or A negative, B positive or B negative, AB positive or AB negative, or O positive or O negative blood grouping. We need to very make sure before administering this type of blood products to the patient. Blood grouping is also the blood typing. It is a test to run a person's blood to determine blood type AB, AB or O. It involves determination of the antigens present on the individual's RBC. Like example, type A blood group contains A antigen on the RBC. B blood group contains B antigen on the RBC. AB blood type contains both the A and AB antigen on the RBCs, whereas the type O blood contains no A or B antigens on RBC. The cross-matching, Rh factor is the protein that is found in covering of the RBC, right? So in the cross-matching, we confirm whether the patient blood is having Rh positive or the Rh negative blood. Whereas Rh is known as rhesus factor. If Rh factor is present on the cell, the patient is having Rh positive blood. If Rh factor is not present on the patient's blood, then it is considered as Rh negative blood. The Rh blood positive cannot be given to the Rh negative blood type people, but we can follow in around different ways. Like example, the O Negative blood is the universal donor. It can give to all different types of blood grouping, whereas the AB is the universal recipient. It can only receive the blood from all different types of the blood grouping. O and A are the blood groups always high in demand. But whether is there any a best type of blood group? There is answer no. There is no different special or the best type of blood group, but we require all the different types of blood group based on the patient's requirement. The blood screening is done in order to find out any of the transmissible diseases present in the donor's blood, such as HIV, hepatitis virus, HTLV, that is the human T lymphocyte, or STS. There are two types of reaction, acute reaction or the delayed reaction. The acute reaction is the reaction may occur from the time of minute of blood transfusion started till the 24 hours. Delayed reactions are commonly occur about 4 to 8 days after the blood transfusion, but may develop longer with serious health problems to the patient. It is very essential to do monitoring and observing the patient during a blood or the blood component transfusion. It's a part of safe transfusion practice. The patient can be advised to inform you if the patient is having tachycardia, rigors, pyrexia, hemoglobinuria, nausea, vomiting, coughing, restlessness, generalized weakness, or the patient looking lethargic, urticaria, headache, hypo or hypertension, chest abdominal discomfort. Have close monitoring of patient at the time of transfusion started. The delayed reactions. Delayed hemolysis or infection, iron overload, graft versus host disease, post-transfusion purpura, or alloimmunization are the delayed reaction, which is very serious conditions for the human body. In case of any kind of reaction, it is very responsible for us to immediately stop or hold on the blood transfusion. Hope I have covered maximum things in the presentation. If you really like it, please like, share and subscribe. Thanks for watching. Leave your comments below. Take care. Bye-bye.